In the wake of last Friday's deadly shooting in Newtown, Connecticut, many are asking, how could this happen?
And debates are raging over stricter gun control laws, but there's now a serious push to bring mental health into the conversation. Adam Lanza struggled with Asperger's syndrome, a mild form of autism. Friends describe Lanza as withdrawn and antisocial. But mental health experts say Asperger's generally doesn't have a clear connection to violence. Well, today, News 3's Meredith Lay spoke with a mental health advocate in our area, trying to provide some insight into mental disorders and how they affect a patient's role in society.
So Meredith, tell us, did she have any insight into this tragedy that happened last week?
Well, Andrew and Tina, we're learning a lot of new information that's come out over the last few days, but it is still unclear what exactly set Adam Lanza off. But it is obviously time to start having real talks about mental health care in this country. According to the Center for Disease Control, more than 25% of all adults in the United States have a mental illness, and about 50% will struggle with one in their lifetime. Today, I met with a group right here in Savannah that's trying to make sure no one goes without the help they need. It's a crisis some health professionals say is sweeping our nation.
There's this big stigma attached to it, and it makes it very hard for people to deal with it or want to deal with it.
And with health care cuts looming in our future, treatment for mental illness is something no one can afford to lose.
They don't realize that when you look at a person, you can't tell if they have it or not.
Severe depression, bipolar disorder, and schizophrenia. It's not just a condition to Jody Whitaker. As the program director for the National Alliance on Mental Illness here in Savannah, it's her job to educate.
People think that you just take medication, then that's all they need to do and everything's fine and dandy.
But Whitaker says there's a lot more to it. A diagnosis can come as early as 14, but it takes communication, and sometimes that can be hard to come by because treatment is not always covered under insurance.
When people aren't being talked to and they're not being able to say what's bothering them, they're not going to find the root cause of what's going on with them. You know, if people aren't being able to be honest with doctors and nurses and intake workers, how are they supposed to get their treatment?
Having dealt with mental illness herself, Whitaker is now a shining example of the good that can come from treatment. Now she's paying it forward.
I've gotten to where I am today because of it. Since I've been doing what I talk about and I've been walking the walk, I have not been hospitalized in over 12 years.
The National Alliance on Mental Illness holds support classes once a week and also offers family counseling services that are free and open to the public. For more information, log on to WSAV.com and use the keyword mental health. For News 3, I'm Meredith Lay.